Ventilators, ventilators, ventilators. I didn't know what they were a few weeks ago. Besides the cursory knowledge, I know too much about ventilators now.
Ventilators are machines that help people breathe. There are different kinds of ventilators, including more basic ones that just involve masks for home use. But the ventilators that are in the news because of the coronavirus are high-end, complicated, and expensive hospital ICU models. They can cost between $25,000 to $50,000 a unit, and they involve putting a tube down a patient's airway and actually helping that patient breathe while they're in critical care and their lungs might not be functioning.
But I have a feeling that a lot of the numbers that are being said in some areas are just bigger than they're going to be. I don't believe you need 40,000 or 30,000 ventilators.
One of the challenges of figuring out how many ventilators we need and how many ventilators a typical hospital needs right now is that ventilators aren't one and done machines. They're not like giving somebody a shot or a different treatment to help them get over the coronavirus. Patients, once they're intubated, can be on a ventilator for weeks. Because these machines are so expensive, they've really been the purview of well-staffed, well-funded hospitals with extensive ICU units.
Look, we're willing to pay reasonable retail prices for the things that we need, but the federal government needs to say to all the companies in the United States that produce these goods that they're going to buy them all together and distribute them across the states.
Hospitals have about 160,000 ventilators in the country, and there are estimates that as many as 1 million Americans will need to be put on a ventilator due to coronavirus. And there are several reasons for the shortage. One, again, these are expensive machines to make. They're extremely complicated. They have hundreds of parts. The supplies and materials for those parts come from all over the world. There's also the problem of regulation, or the necessary problem of regulation. Again, these are life and death machines. The FDA has a lot of strict rules around their manufacturing to make sure that these machines do in fact save lives and don't actually kill patients. Now, the FDA has relaxed some of those rules as ventilator production has ramped up, and we've seen automakers and other non-traditional manufacturers get into ventilator manufacturing, but you still want to have a basic standard regulation of how these devices are created. Also, ventilators take a relatively long time to make. Ford, for example, started working with GE Healthcare and a small ventilator maker called Aeron. They have a goal of making 60 ventilators an hour once their production line is up and running.
We'll probably make about 1,000 in April. By the end of May, we're running at 50,000 per month, and our goal is to produce 100,000 of those.
General Motors is working with a smaller Washington state-based ventilator specialist called Ventec Life Systems. Tesla is in discussions with Medtronic. We've also seen other non-traditional manufacturers like Dyson in the United Kingdom getting into ventilator production. Then once the ventilators are made, there's perhaps an even more crucial and urgent issue of who's actually going to operate them. Emergency doctors and nurses and anesthesiologists are trained to do this, but obviously have a lot of other responsibilities with this surge of infections. There are also trained specialist healthcare workers called respiratory therapists who are specifically trained to put patients on ventilators and monitor them. This might be one of the most crucial issues for the ventilator response to the American coronavirus crisis. There are 160,000 ventilators in the United States. There are 150,000 trained respiratory therapists. And again, if there are 1 million Americans or more who need to be put on ventilators, as one doctor told me, we're going to run out of personnel way before we run out of ventilators.